Welcome back to the Caregiver Minute, where every weekday family and professional caregivers gather to refine their skills, gain inspiration, and prepare to serve. In a recent training session with our team here at A Mind for All Seasons, we talked about managing heart attack risk and what factors will reduce the likelihood that someone will have a heart attack. Randy, our Chief Medical Officer, shared 21 different things that could be done to help someone that has calcification in their arteries. Now, many of those 21 things would require some blood work and/or physician orders, and that might be a little bit trickier to do in a skilled nursing or assisted living setting. So, for the purpose of this video, I'm just going to talk about a handful of factors that anybody can manage in their own lives or in the lives of the people that they serve. Factor number one is diet. If you want to reduce heart attack risk, eat more fibrous fruits and vegetables, eat more pigmented berries, and get more omega-3 fatty acids. Make sure that you're getting plenty of extra virgin olive oil and avocados and nuts and seeds and fatty fish. From a dietary perspective, those things have been demonstrated to really lower cardiac risk factors. The next thing we can do to improve heart health is to get more physical activity. Now, it stands to reason that because the heart is a muscle and physical activity works it a little bit, that it will get stronger. But sometimes people struggle knowing what to do. Well, there's some research that shows that just walking 3 times a week for 40 minutes has 90% of the benefit of other exercise. That's more doable for a lot of people. And sometimes if we just give a person a reason to get out and walk, they're very willing to do that. I recognize that not everyone that we serve can walk, but maybe there are other ways that we could help them move. Even moving within a wheelchair and doing arm exercises, or putting their feet on an ergometer, a set of bicycle pedals where they can sit there and pedal from their wheelchair, can get them moving enough to have some potential benefits for their heart. The next factor to be aware of to reduce heart attack risk is obstructive sleep apnea. And the most common symptom of this is when someone snores like a chainsaw. If you're serving someone who snores all night long and they've never been tested for sleep apnea, and they're not being treated with a CPAP or other device, then it's time to get them screened. Because failure to treat obstructive sleep apnea not only dramatically increases Alzheimer's risk, but it's a 3 times greater risk of cardiovascular disease. That's a controllable risk factor, and it's up to us to be eyes and ears and to pay attention to those kinds of things. Next, we can be aware that dental decay plays a significant role in heart attack risk. People who have poor dental health tend to have heart attacks at a much higher rate. P. gingivalis and other types of bacteria can easily leach into the bloodstream and cause a chronic inflammatory response that will elevate risk factors for a lot of things, including heart disease. So make sure that you help the people that you're serving brush really well twice a day. Make sure that they're flossing or using a water pick. Make sure that they're getting regular dental checkups. And if they've had root canals especially, make sure that their dentist does a cone beam CT scan that can trace down the roots to make sure that there isn't undetected decay there that hasn't been properly treated. The last 2 things that I wanted to share that we can do to reduce heart attack risk are to make sure that we're sleeping well and that we're managing stress. Obstructive sleep apnea will get in the way of a good night's sleep. But if you don't have that problem, you still have choices. If you're not sleeping 7 or 8 hours each night and getting deep, restful sleep, it's increasing heart attack risk. And so the reverse is also true. When people sleep really effectively, their heart attack risk goes down. And it's up to us as family and professional caregivers to not disrupt someone's sleep any more than humanly possible. I realize that some of you serve people who have incontinence issues at night. Now, if someone is incontinent of bowel at night and it's breaking down their skin, yes, we may have to go in and interrupt and wake them up and take care of them so that they don't have a more serious problem like skin breakdown. But there are many situations where we don't need to intervene as often as we do. And we could write things in the care plan a little bit differently to allow people to sleep more. When it comes to managing stress, one of the simplest things that we can do is just practice some breathing exercises with the people that we're serving on a regular basis throughout the day. A few minutes here and a few minutes there of some deep breathing can do wonders to reduce heart attack risk. You've probably heard of plenty of other things that can be done to reduce stress, including interacting in effective ways that don't prompt increased stress. Today, I invite you to look for 1 or 2 ways that you can start applying these principles I've shared to lower the risk of a heart attack for you and the people that you serve. Thanks for watching. I look forward to seeing you again tomorrow for another episode of the Caregiver Minute.